Hi everyone, let's talk about something that the most women suffer silently, often for years. That is recurrent urinary tract infections. Now here is the shocking part. Over 60% of the women will have at least one episode of UTI in their lifetime, and at least 25% of them will have multiple repeated episodes, sometimes every few months. Now, but here is the truth. Taking antibiotics again and again without understanding the root cause is like putting a band-aid on fire. So what is really going wrong inside the body? We need to evaluate. Recurrent UTIs are not common, are not random. They are often the results of abnormality with the bladder functioning, hormonal decline post-menopausal in the aging females, diabetes or the pre-diabetic conditions which affects the bladder immunity, sexual activity introducing bacteria into the urethra, and inflammations and the anatomical issues that are never diagnosed. So women are given the same tablets again and again. No further evaluations is done for them. That's why we do things differently here in Marengo Asia Hospital, Gurugram. We treat the cause, not just the culture report. This is very important. We start with the bladder diary, uroflowmetry, bladder scan to detect any abnormality with the bladder functioning. If needed, we do cystoscopy, which is like a painless looking inside your bladder. We evaluate your hormonal status, especially post-menopausal women, and we assess your urinary microbiomes and customize a prevention plan that is critical to the treatment of UTIs. And we screen for the hidden diabetes, pelvic floor muscles dysfunctions, or chronic interstitial cystitis. This 360-degree approach will give long-term results, not temporary relief. So, do we always use antibiotic? No. In fact, many a times we avoid them. So the dictum or our mantra is not every burning in the urine is a UTI. Not every fever with symptoms of the urinary tract is not UTI. So most of the time we do overtreat. Some of them are being overtreated by some specialists. Now they need individualized and a personalized care. So here we stand different, and let's take a place that not every woman should suffer from a recurrent episode of UTI during their lifetime. Thanks.